Dr. Tan Wu Meng.
Question number 3, please.
Mr. Speaker, with your permission, may I take questions 3 through to 16 together? Sir, we've achieved an 80% COVID-19 vaccination rate at the beginning of September, and a number of MPs have asked for greater clarity on our vaccination and booster strategy and our approach on community measures as we transition into a COVID-19 resilient nation. Sir, we've been experiencing an exponentially rising wave of infections in the community since the 23rd of August. To curb the spread of infection in previous waves, we implemented the circuit breaker and heightened alert measures, which significantly suppressed the rise of infections. The measures worked, but they were painful. They were painful to families, to workers and businesses. It's also not a sustainable way to battle the virus for the long term. So we will need to open up social and economic activities. Otherwise, many people and businesses will suffer, and we risk permanently damaging our ability to earn a living. But we have to do so safely, which means reducing the number of people falling very sick to a minimum. And for this, vaccination continues to be key. When we achieved 70% of our population having received the full regimen of the vaccine, the multi-ministry task force presented a 4-stage transition plan. It's a cautious, calibrated approach, not a sudden opening. At this point, let me address, Mr. James Lim had a question on delays in our vaccination program. Our vaccination program has not been slow at all. We were one of the earliest countries to secure vaccine supplies, with the first shipments of the Pfizer-BioNTech vaccines arriving in mid-December 2020. One of the fastest to roll out a comprehensive vaccination program, and we've now achieved a vaccination coverage that is among the highest in the world. 81% of our population have completed their full regimen, and 85% have received at least 1 dose as of the 9th of September. Members have asked about the criteria for moving from one stage of the transition plan to the next. I can understand the desire for transparent and predetermined criteria. This is of great interest to all of us. Other than vaccination rates, we need to also consider case numbers, the transmission trajectory, our social behavior in adherence to safe management measures, and the status of the testing regimes. So while we have achieved our vaccination target of 80%, taking all of this into account, we have decided to pause the transition plan, given the rising number of cases currently. We're not reversing course, and neither are we charging ahead. Having studied the safety and efficacy data, we will commence our booster program for the vulnerable. Persons aged 60 years and above may receive a vaccine booster 6 to 9 months after their second dose, while immunocompromised individuals will receive a third dose of the vaccine 2 months after their second dose. The Expert Committee on COVID-19 Vaccination, the EC19V, will continue to observe global and local data, particularly on the risk of adverse reactions, before recommending additional population groups for booster vaccines. They are also actively studying a heterologous study. They're also actively studying a heterologous strategy involving non-mRNA vaccines. We are negotiating with suppliers to provide us non-mRNA booster shots, and a few are preparing their applications. We have a deliberate strategy to procure a portfolio of vaccines that use different technologies to improve our chances of securing vaccines that will continue to be safe and effective against COVID-19. Due to commercial sensitivities and confidentiality undertakings in our agreements with vaccine manufacturers, we are unable to disclose more information regarding our current stock of COVID-19 vaccines, the remaining number of doses to be delivered, and their delivery schedules. This also applies to our dose sharing arrangement with Australia. We do not need those particular doses at this point in time, but Australia's vaccine program does. We will need more doses in the future as we increase our booster program, and Australia will return the favor by sending us some doses at the appropriate time. With 81% of our population fully vaccinated, we will close 4 vaccination centers on the 30th of September 2021 and may scale down other centers. We will also increase the number of public health preparedness clinics, the PHPCs, which offer vaccinations from 79 currently to around 100 by the end of October 2021. Those who are unable to go to our vaccination centers or PHPCs will be visited by our mobile and home vaccination teams. Pregnant and breastfeeding women are strongly encouraged to take up the COVID-19 vaccination because they will benefit from the protection. They are more likely to develop severe symptoms if infected with COVID-19. So they will benefit greatly by getting the vaccination. All our experts and our professionals, such as the EC19V, the College of Obstetricians and Gynecologists in the Academy of Medicine of Singapore, and the Obstetrical and Gynecological Society of Singapore have advised that pregnant and breastfeeding women can receive a COVID-19 vaccination. Since last year, hospitals have facilitated patients who are nursed in isolation settings to have contact with their family and loved ones through video conferencing. This is an option to consider taking up if one wishes to communicate with a loved one who is hospitalized without needing to make a physical visit to the hospital. To encourage vaccination take-up, MOH has been working closely with stakeholders to address the concerns of those who have not yet taken COVID-19 vaccination because of medical complications due to pre-existing diseases or misinformation over the vaccines and their side effects, or those who simply do not see the need for vaccinations. MOH has issued clarifications and corrections and, where necessary, applied the Protection from Online Falsehoods and Manipulation Act, POFMA, to debunk the falsehoods. Vaccines can keep down the number of serious cases of COVID-19, but vaccination alone is not enough to prevent infections. It needs to be complemented by pervasive testing and safe management measures to detect and ring-fence infections in the community early so as to control community transmission. We've made available quick test centers to administer supervised self-swabs, but it is also the personal responsibility of individuals to conduct these tests properly. The vaccinate or regular test regime will be introduced on the 1st of October 2021 for workers in high-risk settings. The government will fund, until the 31st of December, the test kits for employees working in these sectors who are medically ineligible for mRNA COVID-19 vaccines. We will continue to review the regime and will make changes later on the basis of the public health assessment. Vaccination differentiated SMMs, VDS, were introduced to protect unvaccinated individuals from being infected with the COVID-19 virus. The F&B industry, the companies and their staff have been responsive and adaptive in implementing VDS requirements for dining in and have been educated on the digital and non-digital forms for verification. There have been some teething issues when this was first implemented, but over time they have been sorted out. Mr. Speaker, earlier in August we outlined a 4-stage roadmap comprising the preparatory stage, the transition stage A, transition stage B, and a COVID-19 resilient nation. We continue to work on the basis of this roadmap, our vaccination and testing efforts, along with our SMMs and all of us exercising social responsibility implemented together, are vital to us staying the course towards becoming a COVID-19 resilient nation. Thank you, sir.
Mr. Lustra.
Thank you, Mr. Speaker. I've got one supplementary question for the SMS. In relation to my PQ on booster shots, I note that the MOH will now offer booster shots to seniors and immunocompromised individuals, as what SMS has said. But just wondering if the government has completed its assessment on the need for a booster shot in general, and what are the rollout plans for the general population, especially the healthcare workers and transport workers who are amongst the first in this country to be vaccinated. And I also note in Minister Dr. Tan's policy links replied to a PQ of mine yesterday, for example, that protection conferred by vaccines may wane with time and new COVID-19 variants may emerge that may be resistant to our current vaccines. Thank you.
Mr. Speaker, the short answer is that we continue to study the matter, and we haven't completed that process yet. When we do, we'll have a full explanation and a discussion.
Sir Alex Yam.
Thank you, Mr. Speaker. Two supplementary questions. Currently, the vaccines that are in use in Singapore are under emergency approval. First, at what stage is HPB at in providing full approval to the vaccines eventually? And under those circumstances, with an expected booster regime in the works, will the government then consider making boosters and vaccination compulsory, as this will address the concerns I raised in relation to PQ6? On PQ7, I asked in terms of concerns over efficacy of the vaccines against new variants, what is the government's long-term plan in dealing with variants, as well as the concerns of citizens that vaccines might not be fully effective when new variants come about?
Mr. Speaker, for full approval to be granted for any of the vaccines, not only do we need the data, but we also need the application from the manufacturer. So the manufacturer has to make the application, the appropriate data needs to be available for our own health sciences authority, and our professional experts here will need to be able to study the matter. So we're not in a position at this point in time to be able to answer that. As to making the vaccine compulsory, well, I think firstly we do need to wait for that process to if it happens at all. We also need to then look at our context, and I imagine the member is referring to what has happened in the US, where there has been that consideration. Our context is different. Our vaccine rates are much higher. The acceptance by our population of vaccinations has also been very different. Well, we will look at the matter, but I think at the moment there is no full approval anytime soon, but we will study the matter when it arises. As for the third question about long-term plans with respect to variants, we have a number of surveillance systems in place. The first layer of defense is our integration into the international network, where variants of interest and variants of concern, the markers for that are shared through a network of professionals. The second layer of defense is our clinical staff on the ground. You have a patient in front of you, and you have to make the assumption that maybe this might be COVID, maybe I need to send a test for this, and that then allows us to activate our third layer of defense, which is laboratory surveillance, when specimens are submitted to then look for the analyses that will tell us whether this is COVID, and if so, whether there's some new variant or it is a strain that we are already familiar with. So we do have a process in place, and that process has been going on for some time, and it is what we have used to be able to get us to this point in the COVID-19 fight already. Thank you, sir.
Ms. Jessica Tan.
Thank you, Mr. Speaker. I have one supplementary question for SMS. You touched on the importance of the testing regime as well. So I'd like to ask SMS, with the greater use of the dependency on the antigen rapid tests and self-testing by individuals and organizations, how can MOH ensure that the integrity of the system and the results do not prevent any undermining of the ongoing efforts to combat the current pandemic?
Mr. Speaker, I thank the member for her question. Firstly, the testing regime is only one part of our overall effort to combat the pandemic. I mean, we have the social measures, we have the vaccination clearly, we have the healthcare system, and we also have the whole process of ring fencing and quarantining and isolating people. And testing runs throughout all this, but again, there is no single testing regime. You have ART tests, you have PCR tests, you have rostered regular testing, and so forth. But all of this requires a certain personal responsibility for an individual. They have to conduct the test properly. They have to sort of adhere to instructions when they're given. But we don't rely only on that. So we have a web of processes, an ecosystem of processes. There is room in there for people to not perhaps execute some of this properly, but there's also plenty of room for people to exercise diligence and personal responsibility, and each of us then can play a part in terms of protecting ourselves, our family, and our entire country.
Associate Professor James Lim.
Thank you, Speaker, and thank you, SMS Janil. I'm afraid I continue to disagree with the characterization that our rate of vaccination rollout was, in fact, as rapid as could be. Admittedly, today our rate of vaccination is among the highest in the world, and there was an acceleration, clear in the data, in the rate in which rollout occurred in Singapore, round about the end of March and early April. But at the same time, it's worth recalling that by March 18th, in fact, Israel's coverage was 60% for first shots. And this is in light of the fact that the government has stated that advance purchases occurred in June 2020, and our first shipments were in December. So I'm thinking specifically about that 3-month gap between January and April, where rollout remained low. And in fact, if I may quote, this was shared in this House by then Minister Ong, that there was a concern that, and I'll quote, that many developing countries are still trying to secure supplies, and fortunately we had negotiated advance purchase agreements, end quote. And so given this fact that we had already negotiated this advance agreement, it's puzzling why we were not able to accelerate this rollout in the first 3 months of this year.
The member is quite free to disagree with me. We had the doses delivered to us as part of the advance purchase agreement. The manufacturers were under some strain to produce as much as they can, not just for us, but for the whole world. But I think our contractual agreements were honored. If he was suggesting that perhaps we should have renegotiated the agreements or not honored the agreements in some way or changed it, he can hold on to that opinion. But I thank him for agreeing that now we have indeed done relatively well compared to perhaps what the situation looked like in March. And ultimately, it is that destination which is of importance and will protect us. At the beginning of the vaccination rollout, our pace was constrained by the supply that was made available to us from the manufacturers. I think this is something that we've explained several times.
Leader of Opposition.
Thank you, Mr. Speaker. Just 2 questions for the Senior Minister of State. Firstly, does the government now have a fix on the number of Singaporeans who cannot take the vaccine for medical reasons? The second SQ is SMS replied that the government, and if I heard him correctly, is that the government is extending free ART testing to certain employees at the workplace. Does the government have a position on testing-related subsidies for Singaporeans who cannot take the vaccine for medical reasons, and not just in workplace settings? So I understand we've got some free ART kits that are delivered to Singaporeans, but for elderly Singaporeans who still cannot take the vaccine for medical reasons or thereafter, what other, is there going to be some subsidies for them for additional ART kits, for example? Thank you.
The issue of cannot take for medical reasons, unfortunately, it's not an absolute cut and dry, because some of it is a continued assessment. You're waiting for example, your chemotherapy to be completed, you recover from the surgery and so forth. So it's not a fixed number. We will pay very close attention to it. It is a small number, relatively speaking. For the second question, individuals who are unable to take the vaccine for medical reasons have some degree of vulnerability, so perhaps may need to be careful about their exposure to the wider community, because the issue of testing is not going to protect them from the vulnerability they have as a result of the medical condition. So there's a little bit of, it's not quite the same as the circumstances where you have someone who, for some reason, is allergic to a vaccine and then cannot complete a vaccination regimen, but would like to then go out and work and is otherwise healthy, which is the situation in which we are then providing subsidies for the ART kits.